Adam Willmann was born in Goodall-Witcher Hospital in Clifton, a small town in central Texas. Now has its CEO, and has worried his hospital may have to stop delivering babies. That's because some of the experienced nurses in the Goodall-Witcher obstetrics department aren't vaccinated for COVID-19, and don't intend to be. But under a new federal mandate, hospitals will soon have to require their staff to be vaccinated. They are also near retirement age and a few of them have already voiced that, "I will just retire," Willmann said. And then a couple other nurses said, "Well, I'll just go work for my husband's construction company." Willmann's situation is not unique. Rural health providers around the country are sounding alarms about the new mandate that will start as soon as next month. The Biden administration wants every person working in a healthcare setting, from hospitals to nursing homes to dialysis centers, to be fully vaccinated for COVID-19. But in rural areas where vaccination rates are low and hiring is already difficult, hospital directors are worried there could be staffing shortages that force them to turn patients away. Willmann has been pushing hard to get all of his 250 employees to take one of the COVID vaccines, but has topped out at around 70%. That's well above the rate in the surrounding community, but still not enough. "We're kind of at that point where everybody that's willing to get it, got it," he said. That stagnation of vaccination rates in medical facilities all over the country is what drove the Biden administration to go for a mandate, said Chiquita Brooks-LaSure, the administrator of the Centers for Medicare and Medicaid Services. "We did not undertake this decision lightly," Brooks-LaSure says. The agency is expected to finalize details of the new requirement over the next month. It plans to withhold Medicare and Medicaid funding from facilities unless they follow the mandate. Brooks-LaSure said she knows some hospitals and nursing homes are worried the vaccine mandate will cause staffing shortages, especially in rural areas. But she said healthcare workers who aren't vaccinated and become sick or have to quarantine also cause staffing shortages. The government is also concerned about safety. "It's very clear from the data that staff who remain unvaccinated are affecting both the patients who are coming into the facilities as well as their colleagues," Brooks-LaSure said. Brooks-LaSure said staffing issues may not end up being as severe as some fear. She pointed to the experience in Maine, where Governor Janet Mills put a state mandate in place for healthcare workers. Even though there was a lot of noise around what these mandates mean, the actual number of healthcare workers who quit was very limited, Brooks-LaSure said.